This is the news on fake hospital admissions, fake medical procedures, and this is the news where public health services are overwhelmed.
Hello friends, welcome to CNS Viewpoint. Today we are going to talk about two very interesting news that I read in the newspapers on the same day in second week of February 2022. Because they were published on the same day so that is why the contrast was so evident. And the reminder was so strong like a punch in the face of why public health services are so acutely important if at all we want to attempt to deliver on health justice for everyone where no one is left behind. COVID-19 had shown us that in this public health emergency it was only government services, government-run public health services that were actually delivering. And we all know that barring very few exceptions, private hospitals and private healthcare infrastructure had almost collapsed or closed, or they were quarantining. In many states in early stages of the pandemic, government had invoked a special law to take over private hospitals and infrastructure in several states of the country. So I'm just saying that this is another reminder. So what were the two news about? One news was about a private government hospital, a private hospital in Thakurganj area of Lucknow, which is associated with a private medical college, that it had kept daily wagers in captivity, and to show fake hospital admissions, to show that those daily wagers who were admitted on falsely admitted, I mean they were getting paid on a daily basis just to lie as fake as a patient, and they were surgical procedures performed on them, or cuts, etc., as per that news, and there were IV fluid or Vigo, etc., that were in their hands and stuff, which were found. So fake admissions, fake medical procedures, fake hospital, indoor patients, fake OPD. This is what private hospitals have come down to. And why did they do so? As per that news, they did this because to get the green light from the government medical regulators who regulate private medical colleges and hospitals. So this was one news. The other news was that in Lucknow, the government hospitals are under so much of pressure because of patients, that in several departments which perform and offer life-saving procedures, they are under tremendous pressure that they have to give waiting list of weeks and months. So there were King George's Medical Universities, Gandhi Memorial Associated Hospitals, or Sanjay Gandhi Memorial, Sanjay Gandhi Postgraduate Institute of Medical Sciences, or other hospitals in Lucknow. So imagine, on one hand we have government hospitals that are under so much of pressure that they are forced to give waiting list of weeks and months for life-saving interventions. And it is common public knowledge that if you step into any government medical hospital, you will realize yourself how much the crowd is, how much pressure medical doctors and other healthcare providers are facing in the public healthcare institutions. At least in Lucknow, this is what I have seen. And if on the other hand, in main Lucknow, there is a private hospital which has to pay daily wagers to be their false patients and undergo false procedures so that they can qualify to get medical regulators green light. So choice is in our hands. What kind of medical infrastructure do we want? A private one which goes for fake admissions, which do profiteering, which do hoarding, which jack up prices, which loot us, or do we want a government-run public health services which can ensure health security for everyone where no one is left behind? Choice is ours, friends. Choose wisely. Choose for yourself and each one of us, because there is no way that only some can enjoy health security, whereas the rest of the planet will enjoy insecurity or suffer insecurity. So think and choose. Make a choice. Thanks a lot. Tomorrow again we will be back again at 5 p.m. India time with the thoughts and views and perspectives of something that made us think. Bye till then.